Okay, I can hear the noise quieting down. We're gonna all this thing about us being ahead of schedule is just going out the window. So now we're behind again. But we're gonna get started. Thank you. Just wanted to bring this room to quiet, and I will turn it over to Olivier.
Hello. It's me again. How many of you were in this session when I was talking? Oh yeah, there are some new people. Anyway, someone told me when you have a microphone, make good use. Talk about yourself first. So my name is Olivier Nsengimana. I come from Rwanda, and I am the founder and executive director of an organization called Rwanda Wildlife Conservation Association. Today, we're not going to talk about Rwanda Wildlife Conservation Association. We want to tell you about One Health. And today, we have an incredible panel, like women that respect so much, that are going to be really telling us, and we are going to be discussing about One Health, and we are going to open the questions and kind of chat with you and think about One Health, how we can make good use of One Health approach to save our species and our people. So I'm really going to start introducing these amazing women here on the stage. And as I introduce them, I will ask you to give them a very warm round of applause. So I'm going to start by Dr. Rocio Palacios. Thank you. Rocio has been interested in wildlife, particularly feline, since the age of 11. She's studied biology, and she's now the current general project coordinator for Andean Cat Alliance in Argentina. Welcome on stage.
Thank you, Olivier. Thank you.
You might take a seat. And now I will introduce Dr. Gladys Karema Zikusoka, a very good friend of mine.
Good name.
So, Dr. Gladys, take that seat, please.
Oh, okay.
Oh, yeah. It's all right. Yeah. That's fine. Dr. Gladys Soka is one of the leading conservationists working to save the endangered mountain gorillas in East Africa. She will tell you a lot about her work. I don't want to really bore you reading a lot of their CV. I know you know a lot, but they will be telling you. And now, my very good friend, Jorgelina, Dr.
Yes.
Jorgelina.
Yes.
Jorgelina Marino.
Hello.
So Dr. Jorgelina
Marino.
Oh, Jorgelina Marino was born in the Argentine Pampas, and she studied biology. And now she's working as a science director at the Ethiopian Wolf Conservation Program. So welcome.
Thank you.
On the stage.
Thank you.
Wow. So can I take a seat now? Thank you so much. Let me take a drink. Actually, from the morning I didn't have a drink. So welcome on the stage. One Health. The very first time I came across this approach of One Health is actually when, after university, when I went to work with the gorilla doctors, when we were using the One Health approach to save the endangered mountain gorillas. And again, when I was there, I was on a project called Predict. We were doing the surveillance of disease. And as a vet, for the very first time, I thought actually humans are so much now concerned of disease that can come from wildlife. Now vets will have a value. So within the same approach, I felt like I was playing a huge role to identify disease that can be a potential threat to humans. And that's the very first time I was starting to understand One Health. But later on, I understood that also One Health is really so crucial to the conservation of the same species that we work with, that we love. And today we are so happy to have you. I feel outnumbered, but really honored to be honored to be with you. And again, we have this great audience, and they want to hear from you. I want to stop talking and start really chatting to you. But I wanted really to kind of mention that One Health, there is the most recent definition by WHO, FAO, OIA, and UNEP that says One Health is an integrated unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. Did you hear anything? Did you get anything? You know, so sometimes when I read such things, I don't get things. Let's talk to the expert. So I will start with you, Gladys. You know, like for someone who's been really in the field of using One Health approach for a long time, and I know I've been following you, and you are a great inspiration to me. I want you, like, to tell people here, really tell us in your own words, like someone who's not a scientist, what is One Health? And actually, you've been using this One Health. How does it fit in your work? How does your work fit in the One Health approach? To you.
Thank you, Olivier, and good afternoon, everybody. Morning or afternoon. I'm very excited to be here, and this is my second visit at the WCN Expo. I was a guest speaker in 2009. I would say that we started implementing One Health before it was termed One Health. As Olivier mentioned, gorillas and people are very closely related, and they can easily make each other sick. So my very first job, I was hired because of that reason. I was hired because gorilla tourism had just begun in Uganda in 1993, and they were looking for a vet to make sure that the tourists who come and visit are not going to bring them a fatal flu, such as COVID-19. So that's why I was hired. But the first disease that I had to deal with in the gorillas was not from the tourists, it was from the local community. Once the gorillas are habituated for tourism, they lose their fear for people, and they start to range in areas where they used to range before, let's say, people had cut down the forest. And so 2 gorilla groups kept going outside the park, and they reported to me that they were losing hair and developing white scaly skin, one of the groups. And we went up there and found out that they had scabies. And eventually we found that it came from people living around the park who have very little health care. And they basically found dirty clothing on scarecrows, touched it, because gorillas are very curious, just like people, especially the baby gorillas. And it probably spread through the group in that way. And that's when I started to think about One Health and realized that we couldn't protect the gorillas without improving the health of the people. And so when we held health education workshops with them a few years later, actually everyone asked me to lead that effort because I was the only vet in an organization, a government entity, Uganda Wildlife Authority, which was full of conservationists. And that was a turning point in my life because I started understanding public health. And when we held health education workshops with the community, they told us that they don't want to make the gorillas sick, especially the ones who are benefiting from tourism. And so they came up with fantastic recommendations. And some of them were they want health services brought closer to them. Others were we should strengthen the human-gorilla conflict team that herds gorillas back when they come out. And the third recommendation was we want more health education. And so, yeah, that's how we set up an organization, Conservation Through Public Health, to basically try and address this issue. So I would say that One Health is disease, addressing human, animal, and environmental health together. Because if you only address one or the other, people keep getting sick, animals keep getting sick, and you won't be able to really break that cycle of zoonotic disease transmission. That's one aspect of One Health, but there are others as well.
Thank you so much, Gladys. And I remember the last time we were chatting, you were saying when you're celebrating World Gorilla Day,
Yes.
some members of your community, you were talking about One Health, they were asking you the definition of One Health in a local language. Did you find it? Like, are you working on that? Like, did you finally, make that definition in a local language?
In the local language. I know, it's like when you have to say something simply, you have to say it in the local language. We celebrated Wild Gorilla Day on 24th September, and the local TV was interviewing me and said, say that in the local language. And we really broke it down. But the thing is, the local communities face One Health every day. You know, they don't have a day for their children getting sick, another day for their goats to get sick, another day for gorillas to come to their garden. Sometimes it happens at once, in the same day, in the same week, in the same month. Yeah. And so you need a holistic approach to be able to address all these various issues in their lives,
Yeah.
which affect the endangered wildlife.
Yeah, yeah. From my understanding, it's like there is no single way to define it, but we can define it with the life we live every day. All those events that happen, just there is a lot of One Health. Yeah. So coming to you, Rocio, Andean Cat. I really was impressed to look at you when I looked at you on the website of your organization. 4 countries bound together to save this beautiful cat, and really we are trying to do that, and it's powerful itself. But I realized that you are using this the One Health approach is really only coming into your work recently, and I just wanted to ask you why One Health now and why not before?
Well, thank you for the question. Yeah, actually, when I was invited to the panel, I was like, why are you inviting us? We have been this program like for a year or something. And with these 2 huge experts, it was a little bit scary. But finally, I understood that they invited us because we are learning from each other. For us, I think we are stretching the concept of One Health, or maybe we started from a different side, because our main reason to start doing thinking on One Health now is because domestic dogs, were actually killing the cats, attacking them and killing them. So the problem was more direct. And in this context, vaccination and working with the dogs and the communities is our way to, increase responsible ownership. And of course, with this, a lot of things come behind it. You cannot work with animals that transmit disease and not address that those diseases are being transmitted to the community too. So we have been working in this scenario, but we have the chance to learn. We had, when we were in the middle of the pandemic, a very nice panel that we did with Ethiopian wolf. Mm-hmm. And, Claudia and Jorgelina very nicely gave us key points for how to plan a good, vaccination campaign, something that is really successful. And the support of the community is absolutely fantastic in this context.
That's really fantastic. I remember when I was a vet, and the first time we went on a campaign to vaccinate dogs, and it goes with a lot of campaign to raise awareness, and this is why it's One Health, really to tell people why every single bit of the puzzle matters. So I just wanted to ask you, is this issue happening, of the dog attacking the cats in all 4 countries, or?
Well, it came from a community, basically a community request, but what it's interesting is that we found that it's happening everywhere. Let me add that, we started doing vaccinations because it's what the community needed, vaccination neutering Spain, but after 22 years of working in the 4 countries where the cat is, if there is a cat that appears somewhere, we're going to find out in less than 24 hours. Tourists, tourist guides, people that are driving next to the road and they see a cat dead somewhere. Eventually, some of our members are going to find out, if the cat is alive, we're going to try to do something. Usually, when we get there, they're not there anymore. But sadly, some of these records are coming from animals that you can see that they are sick. Even with the picture, you can see that they are visibly sick. Yeah. So we don't know what's really happening, but we know that canine distemper and rabies are prevalent in the domestic carnivores populations. So they may be getting some transmission there. But until we know, we have to start doing this because we don't have enough cats for losing them, for a canine distemper outbreak or something like that.
I think Jorgelina will be able to really bring us to that, because I think the Ethiopian wolf conservation program has been dealing with such issues. And, wolves are one of my favorite species. And you work with one of the most unique and rare species in Ethiopia. And being habitat loss and disease, as you're suspecting disease, from those events you've seen, disease is also one of the biggest threats for the Ethiopian wildlife, Ethiopian wolves. And I wanted to ask you, Jorgelina, how are you using the One Health to prevent this disease from spreading or into wolves.
Yeah, yes, you're right. Diseases are a major threat to many endangered species across the world and many carnivores, and the Ethiopian wolf is one of them, sadly. And I mean, following on your point earlier on, I think we've been doing One Health for many years without maybe even knowing it. And before, One Health became like a crucial tool for conservationists. And well, we earlier on recognized that rabies could kill many Ethiopian wolves over a short period of time. And I think it was early 90s, the population that Claudia was studying at the time, 2/3 of the animals died because of rabies, which is also a horrible death. And of course, it sets back any other conservation effort that we are doing to protect them. And then we also learned that the diseases were maintained in the local domestic dog population because it's so abundant, like you are suspected in your case. And every now and then the disease spills over into the Ethiopian wolves, and then we have an outbreak. And so since 1997, we vaccinate domestic dogs all around where the Ethiopian wolves live, thousands a year. But the rabies doesn't only kill wolves. Rabies kill people, and they even kill livestock. And in Ethiopia is the second only after India in the number of human deaths caused by rabies. So it's a serious problem. And so here's where the One Health idea come into place, because one of the main tenets of it is that when the health of animals or people or the environment is enhanced, all other components will benefit as well. So in our case, by vaccinating domestic dogs, there are fewer cases of rabies in the human population. And then we compare, for example, villages where we were doing vaccinations of domestic dogs and villages where we were not doing it. And we also saw that there was a difference, like a household will be $70 off better by not losing their livestock. So it also affecting their livelihoods. So, even though we do also vaccinate Ethiopian wolves, we vaccinate them when there is an outbreak, or more recently with an oral vaccination in a preventive way. And that might be a more efficient way, maybe, to protect the wolves. We continue with the domestic dog vaccination because of these benefits to the communities. And also they see us and our work in good eyes because they are benefiting from conservation. So this is a good example on the positive side, how One Health can be a win-win solution to some problems. So, it takes time, but I think it's really a very positive way to do conservation.
Absolutely. One Health brings this win-win opportunity. And again, in this field of conservation, it can be easy to go and zone yourself in your wildlife, the species we love the most. But we have to remember that the same health and the success relies on also the better life for the humans and the livestock that live in the nearby. So that's a really good example. So when they asked me to facilitate this panel, and I was thinking, my goodness, like what am I going to say? But I actually took initiative to go and ask people nearby me, say like, who do you think One Health is for? Like, who actually practice One Health? And I wanted to know. And many people, they told me, you, like they were pointing at me, like conservationists, researchers. And I felt like this is really a great question I could bring here on a stage to discuss, because we all want to understand what is our role in One Health. And I wanted to start by you. And I know you've already started using the One Health approach, and that is the reason why you started. And maybe you are still exploring. And who do you think is this approach is for? And actually, if there is anything you feel like we want to share with the other panelists where they can help us to understand more, please.
I feel like when I was in class and the professor will ask, "Oh, you, the one that's sleeping in the back." That's how I feel right now. Thank you for that question, Oliver. Discussing this before, Gladys was brightly, when he said, "I don't know what to answer to that question," she said, there's only one answer to that. It's for everyone. And it's like, yeah, you're right. No, we're thinking about One Health as for everybody in the future.
Yeah.
The thing is that right now we are just starting. This project was conceived in the middle of the pandemic. And we are lucky because we have the network, so we have an advance. We don't have to reinvent the wheel, but it takes a lot of time. It takes a lot of effort. One aspect that I think is very interesting in our case is that this program, that it's a program for us, not a project, came because it was requested by the community, a community that we were working with in a completely different matter. We were working with them in sustainable mining practices. They were traditional gold extractors. And I was surprised when that project got to a natural conclusion. You maintain a relationship with the community because became friends. And they asked us, they told us, we see these dogs, these feral dogs attacking a cat the other day, and a vicuña, and my llamas. So they were having a real concrete problem that affected not just the Andean cat, but also their livelihoods. And when we started, okay, so what can we do with the dogs? Well, it's hard to work directly with the feral dogs populations because in our countries, there are not any laws that allows you to kill a dog, which we don't want to do either because it's a very hard thing to work with.
Absolutely.
But to reduce the population of feral dogs, at least we have to increase the responsible ownerships of the pets in the community. Less unwanted litters, better health. So that leads to a reduced amount of dogs. They don't need to have 14 dogs if they have 2 healthy dogs. So it's one thing bring to another, and we were panicking because we didn't know what to do, and we went to our community, our network, and we found that this was very successful. But one thing that I think goes a little bit back to what you were saying, Gladys, these communities are really isolated.
Yes.
Even when they want to do the right thing, they want to spay the dogs, they want to neuter the dogs, they want to vaccinate the dogs. They told us, like, it's impossible for us to take the dogs 4 to 5 hours to another village, to get the vaccines or to get them spayed. So even if they want to do it, even if they have a truck to do it, these cats or dogs have never been into a truck before, and we know how cats and dogs are when you get them in a car. So these guys, even if they wanted to do it, they cannot. So you have to bring it to them. Mm-hmm. But in our situation, because we work in such a vast landscape, the challenge is how do we make it sustainable in the long term? And that is when we have to try to engage governments. And that's very hard.
Yeah. I really love that you talk from the heart, from the experience. All of these things come from the experience, the demand from the community, the very first actor for One Health. And again, you finish by the governments. And this really brings something I've been thinking about. In my country, we've been fighting for this One Health really to become operationalized. And the Minister of Health and Agriculture, and they all came together and then they made One Health strategy together with Wildlife Department, and we are implementing that kind of One Health together. And actually, 1 week before I came here, we're sitting together looking at disease and making a strategy how we can do surveillance in the people, in the livestock, in the humans, really coming together, working that way. But I just wanted to ask you from experience. You've been working in Ethiopia for a long time, and how's your experience working with the government? And actually, what do you see as the role of politicians in One Health implementation?
Yeah, that's a good question, Oliver. This topic we are discussing now is important, and because the One Health concept that we are trying to understand and define highlights that the health of the humans and the animals and the environment overlap. And what it calls it for an integrated action of all these sectors. So the idea is that if everyone works together, then everyone benefits. But our experience in the highlands of Ethiopia, where the Ethiopian wolves live, has been a long journey. And initially, but even still today, the Ethiopian Wolf Conservation Program is like the main force driving the control of rabies, in particular in the Bale Mountains. That's where our work is focused, is where most of the Ethiopian wolves live. I lost track of what I was going to say.
The government.
Yes,
Yeah.
exactly. So there are many issues on many difficulties on the way, and some are cultural, for example, or logistics. And initially, communities, they didn't want to vaccinate their dogs, or they have this distant relationship with the dogs, particularly Muslim communities. And then there is the logistic challenge. We have to go house by house in the Bale region because there are no roads, no veterinary services. With time, with awareness and education, for example, we've won the hearts and minds of the communities. Now, people willingly, they bring their animals. But still, there is that gap in the government capacity to deal with these serious issues, because rabies is a very serious issue. So it will be better, ideal, that more government agencies are involved. And that is something that, we all look forward to, and which is the true nature of the One Health. So we're trying to do that, and training veterinaries from the local governments, and with workshops, giving some materials for vaccinating dogs. It's very difficult to catch these dogs. They are really not like our pets. I think there was a photo there when, holding the animal. And then we also build disease alert networks. So we connect all these people, some parts, and so the information flows. And also because when there is an outbreak, we have to react quickly if it's threatening the wolves. So we're doing those things, but it's a slow progress. And because there is no mobilization of funding from these other sectors in response, you may have a training and a workshop, then that doesn't translate maybe in more dog vaccinations or better care of the dogs. So I think that is something that, we aim to a more balanced situation. Health sector and the livestock health sector, it will be better that, funding, resources also come into wildlife conservation and not always the other way around. We are doing this work, but I think we need to, integrate all the parts. And I think that's a challenge. And maybe politicians and maybe other groups, pressure groups could, work more. Do we have enough support for the wildlife and the environmental health part of One Health to make this happen? I don't think so. I don't think so.
To achieve the bigger impact, we need the help from all of those actors, everyone, from politicians to other stakeholders, and again, we are talking of rabies, and I wanted to come. We've all lived the horrible time during COVID time pandemic, and Gladys working with the endemic and the endangered mountain gorillas, only found those forests. And given how gorillas are so really fragile and susceptible to respiratory disease from humans, it must have been the most worrying time of your career. I can really imagine. But tell us how you use the One Health approach actually to prevent this disease from spreading to gorillas. And did you who were the actors? Who were the stakeholders? We want to know your experience working with the government or other stakeholders.
Yes. Yeah, you're right, Olivia. I haven't rested during COVID. I think I need a holiday.
And you got it yourself.
I know. I ended up getting it as well. COVID has been a very, very worrying time for people working with great apes, especially because, first of all, the mountain gorillas numbers have started to increase, and we're worried that COVID was going to reverse that trend. They've almost doubled over the past 25 years, from around 650 to now just over 1,000. And so we were very, very concerned when, COVID began. And actually, before COVID began, we found that people were getting too close to gorillas, especially when tourists visit. I supervised 2 students, and the research that they came up with, one was from Ohio University, the other one was from Oxford Brookes University in the UK, and they found that tourists were getting too close, but they were willing to wear masks. It increasingly became aware that they need to wear masks. But the governments were reluctant to get people to wear masks. But however, when we were seeing all these photos of people in China wearing masks, I spoke to the Wildlife Authority, my former employer, and I said, isn't this the time to start getting people to wear masks? And luckily, they also saw the urgency, and we continued to lobby them. And they said, yeah, we should do it. So by the time COVID got to Uganda towards the end of March 2020, we had already started training the rangers to put on masks. We got a local entrepreneur to make cloth masks because Uganda ran out of surgical masks, just like everywhere else at the beginning of the pandemic. And so the rangers started to wear masks. Then we also eventually tourism was closed for 6 months because of local lockdowns and, people weren't coming in anyway. But they were concerned about COVID spreading between people, but spreading also between people and gorillas and chimpanzees. So tourism was closed, especially for the great apes. And during that time, we realized also that gorillas are going to keep going outside into people's gardens. That's how they got scabies. And funnily enough, we treated them with ivermectin that time. Don't talk about ivermectin now with COVID. It worked with scabies, but it didn't really work with COVID. But so we had to start training the gorilla guardians who had gorillas back when they come out. They had to put on masks before they could hug the gorillas. Anyone within 10 meters of a gorilla has to wear a mask. And then also you talked about how do you get services to the people, Yelena. And we had started to work with community health workers. In Uganda, they're called village health teams. We started to train them to do conservation work in 2007. So they were promoting good health and hygiene in people's homes. Each one is in charge of about 40 homes. They also talk about, if someone has scabies or suspect tuberculosis or HIV, they get them to be referred to the health centers. They also started to promote family planning. So they were able to refer women to either get an injection or the pill or whatever worked best for them. And so we used this same group of people to also talk about the dangers of COVID. And if anyone saw a gorilla in their garden, they quickly alerted the gorilla guardians to herd them back and no one went near them. But they also, hand washing stations went up. Hygiene, hand washing. And we tried to make sure that they also got masks, especially the volunteers. They're all volunteers, which is amazing. And so we tried to use existing structures, One Health structures we had already set up to address the pandemic. I think the most frightening time we had was when the Delta variant came to Uganda. It got to Uganda as well. And because it's a poor country, we didn't have as many cases as US and Europe, but because it's a poor country, there's very few ICU beds and there's very little oxygen. So the country ran out of oxygen. And so the Ministry of Health asked us, our NGO sits on the Ministry of Health task force, disease task force. So we sat on the COVID task force because of our One Health approach to conservation. And they asked everyone all the NGOs on those task force to develop village COVID task force committees because that's the only way you could stop mild cases becoming severe cases when there's no beds or oxygen. So we worked with our village health and conservation teams to head these committees. We set up 59 committees in 59 villages where there's high human and gorilla conflict. And I spoke to the Wildlife Authority and they said, yeah, we need to have a ranger attending all these meetings because they need to know the homes where gorillas are coming out and whether those people have COVID. And then the chief warden said we should also get the porters. These are people who carry tourist luggage to the gorillas. Because some of them, we found out, they hadn't had work for 6 months and they were really, some of them, their dads had gone back into the forest to poach because they were reformed poachers. But as their son was no longer bringing money home and they were desperate. And so some of them were like, I have to go back and work. Even if my family is sick, I'm feeling better. But now we would stop those people working. So on this committee, we also had schools, religious leaders, the women's groups. So it was a One Health Village COVID task force. And actually, when they asked us to present it, WHO and all those groups were really impressed. They were like, oh, this is One Health in action. Because we brought the wildlife actors, the livestock actors, and the human actors together. So, COVID has been a very worrying time, but we've been testing the gorillas for COVID and testing the people for COVID. Luckily, when you test gorillas for COVID, you don't have to put a swab up their nose. You can actually test them for COVID using a fecal sample.
Oh, that's
non-invasively.
good.
And so, yeah, that would be very hard. They wouldn't like it. And so we've been testing them every month because we're testing them for other things anyway, parasites and other things. And luckily, we've not seen any COVID in the gorillas. If we've had it in people, we've made sure that those people come close to them, get treatment as soon as possible, and get all the rights, they keep away from the gorillas and they keep away from other people. So, yeah, it's been a very worrying time, but the One Health approach really helped to reduce COVID in the gorillas, but also the people.
Yeah, first, like, really, it's like a puzzle. You just, like, put together really quickly, like, telling us how you manage to think of every single thing. And that's really One Health in action. Well done. And it's tough. And I know, like, both countries working together, Uganda, Rwanda, and DRC, really to try and secure the mountain gorillas. And this is a disease that can really decimate the whole population. And actually, One Health, this is where it comes in action to save a species. And just wanted to ask you,
and actually, just to say that, Olivier, just to add on to that, with Rwanda, during the COVID pandemic, we developed all the stakeholders, led by International Gorilla Conservation Program, developed a COVID contingency plan, for the gorillas the mountain gorillas in Uganda, Rwanda, and DRC.
I was actually going to ask you that.
Yeah.
I know at the African Protected Area Congress, that's when it was launched, and it was really good to hear. Yeah, you can probably take a minute, tell about that.
Okay. Talking about engaging the government, even before I talk about that, there's a National One Health platform. I don't know if you have it in where you work, but in Ethiopia, I think Ethiopia has one.
Do you have that already?
Like an
I'm
app?
pretty sure
It's an
Ethiopia
application?
has one. No, it's like a government. It gets together the Ministry of Health, the Ministry of Agriculture, and the Ministry of Wildlife and Environment. Who's the fourth ministry? I think it's tourism. But anyway, they all get together and they all develop things together. So
is that something that exists in your...
Yeah.
The groups get together and they talk a lot. And I don't want to criticize talk.
Yeah.
But when we go to where the wolves are, we are doing the work. But we have to keep believe and be maybe more proactive, because your example of when the wildlife sector and the human health sector got together during the COVID, it shows that it can be done. Maybe it's what type of emergency can trigger that response.
Yeah, they normally turn to NGOs to provide case studies, so you need to get them to visit you.
All right.
And then they can understand the One Health approach and how they can do it at that level. So we always host them for study tours. But what Olivier talked about was a policy brief. Actually, one thing we did during COVID, I forgot to talk about that. We decided to develop a policy brief under the Africa Civil Society Alliance, Civil Society Biodiversity Alliance, which started during the pandemic because we couldn't meet. There's a big conference called the Convention on Biological Diversity, and all these groups that work on such issues couldn't meet because of COVID. So, and yet the African voice wasn't really heard. So this was to strengthen the African voice. And I joined the ACBA. And so when we started to talk about the challenges we're all facing, because everyone couldn't get to their communities, poaching went very, very high because there was no tourism and people were really struggling. So then I talked about the work we were doing in Bwindi regarding One Health, preventing disease to gorillas. And they loved it. And they said, why don't you do a policy brief? So we developed a policy brief with International Gorilla Conservation Program. And it's for all the 13 countries in Africa that have great ape tourism. So just as the gorillas are at high risk, so are the chimpanzees. Yeah. And it's all about getting everyone to wear masks, even after the pandemic ends, because there are other respiratory diseases that can come up. Yeah. And they'll always be at threat from human disease, but also maintaining the distance and very strict hand hygiene. And also just saying it's not only about making money from the great apes. Because yes, they're helping, people are benefiting from them. Everyone is. The tour operators, the government's able to pay salaries because of gorillas. They contribute 60% of the revenue for Uganda Wildlife Authority. But at the same time, you need to make sure that the gorillas are not getting sick from people. So it's finding that right balance. But also at the same time, making sure that tourists meet communities. It's not enough for all of you who get to visit Bwindi, and I hope you will, to see the mountain gorillas in Uganda and Rwanda, make sure you visit the communities, because when a community member meets a tourist, they're much less likely to go into the forest to poach. Because the tourist buys their crafts, the tourist buys their food, they take them on a walk, and they realize these gorillas are important. They're helping to lift me out of poverty. Because of the gorillas, I'm having this benefit. And my family is benefiting. That's very, very important. And so that's all that we put in the policy brief. And it was launched during the first IUCN African Protected Area Congress, where we basically said all the 13 countries that have great ape tourism should follow this kind of responsible tourism to great apes. It's geared towards tourists like you, donors, and the government.
That was really a great achievement. Talking a lot, we've been chatting, but before maybe I open the floor to the public, I wanted to ask you, we are all implementing One Health, and definitely it's not something that happens one day and it's finished, and it continues. And I wanted to ask you, what are the most pressing needs in the One Health implementation in your field of work? Just I will give you a short time each one to tell us, how can we help you?
I have a list.
Oh yeah. I love that. I really love it.
No, really, like, to be honest, because it's just a new program for us. We are trying to build a team, so we need support, like physical, economical support for salaries, for instance, because in our countries you have to hire vets. I cannot go by myself with my PhD in biology to go vaccinate a dog.
I'm a vet,
Yeah. You wanna come? Okay. We also need volunteers.
Oh, yeah.
That's fantastic. And we also, one thing that we are really urged to know if the cats are really getting sick or not with canine distemper, rabies, or whatever else. So we need to do a lot more fieldwork. It's very hard to work with these species. Out of 100 cats that you collect in the field, each one takes a lot of time to collect because they are very hard to find. You have to find very fresh ones, and out of 100, less than 30% are going to be ending cat feces. So it's very hard to get enough numbers. So we need more time in the field. We need to be able to test for disease. So we need to, we have a very good genetist in our team. So, but we need to get, support or kits, accessibility to labs. And one thing that we are really interested, we talk about it, I listen to you ladies. I think it's a huge challenge to work with governments. But in the scale that we work, we really need to find a way to make these projects in some sort of way self-sustainable. Because it's impossible, physically impossible for us, there are 34 people in the Andean Cat Alliance, to reach 1 million square kilometers. To all the isolated communities and to go vaccinate all the dogs in these areas. So we need to engage governments in a higher level. So if anybody has any ideas, please.
Connections. Yeah. And to you, Gladys.
King Charles.
See?
That'd be very handy.
Yeah.
I think actually our needs, even if we've been implementing the One Health approach for close to 20 years, next year conservation through public health will be 20 years old, we still have a lot of needs. And a lot of those needs are very similar to yours. We need more staff. As we're expanding to new areas, we need more staff, we need more veterinarians on the team. You talked about being able to reach all those livestock. With the human health sector, at least, there's a village health team structure. In Burundi, we tried to create community animal health workers, although recently the government tried to abolish them because they said they're pretending to be vets. I'm like, but the vets can't reach there, so we still need them. So that's another advocacy thing to the government that we have to do, because we really need them. You train them, they're kind of like para-vets, but they can do basic stuff, deworming, they can look out for animals that are sick, they can help in vaccinations. So try and create them maybe wherever you are. The government will catch up later.
Yeah.
And so we call them community conservation animal health workers. But we need support for more veterinarians. We need to do more diagnostics because during COVID, we were collecting fecal samples in a certain RNA later, which preserves viruses. Then we had to take them to the human referral lab for testing. It's possible to do it wherever we are because we have a gorilla health center where we carry out other tests. We got support from TASC, who also works closely with WCN. And so being able to increase that diagnostic capacity to catch any of those, respiratory viruses that could be coming in, even not only COVID, but others, or any other types of new pathogens that keep coming in, is something that we really need support for.
Yeah.
And so
I hear like a common theme like staff, diagnostics, and all of that really does already.
Yeah, it's what we are talking about show us how complex it is, and also that you need continuity.
yes,
Continuity in whatever you're doing, and you need all these tools. You have to keep using all the different options and tools, and so that is the case for us. And this continuity of our One Health project, we call it that way, is a bit in danger now in itself, because we are coming to an end of a grand circle from the European Union. And so yes, we need support and the things we, to be able to keep the team working, and then remain alert. You have to be alert for outbreaks all the time, everywhere, because you need to react. So that means continuous monitoring, increase the capacity of vets, and get to that stage. We are probably multi-sectorial, and we need to do that, and more disease alert networks as well. And then focus a bit more, in our case, also with the dog owners, because their behavior, what they do, how they manage their animals can have a great impact. So any help will, big or small, as we always say, will contribute. And we have to do our health. We have to do it. We cannot stop.
Yeah. And actually being able to do the spays and neuters. What's really interesting at Bwindi is we find the times that we do rabies vaccinations, the best looking dogs are owned by poachers.
Oh, interesting.
They really care about their dogs.
Yeah.
They do.
Because their dogs work for them. And that's what we find. But it's very important to vaccinate them. Because if they get into a fight with a gorilla, which has happened before, unfortunately, a gorilla was killed when he got into a fight with a hunting dog. They can spread rabies even to the gorillas. So,
Yeah.
Wow. Ladies and gentlemen, you can be part of One Health one way or another. We are in this together. And I'm going to open the floor for all of you to ask questions, starting by you. You have a microphone.
So questions have been occurring to me continually as you talk. But just picking up on what you just said, Badis, about the poaching dogs, of course, that they take care of their capital. And but what if again you pay the poachers to spearhead the vaccination and the dog care and the neutering and spaying? What if you redirected them? Like sometimes the poachers get given a new role as protectors of different species. Would that be feasible at all? And then for you about the dogs that can get rabies or distemper and pass it to the wolves or to anyone. I mean, they can also pass it to their people. And people generally at least care about themselves. So that could, would that not be, could that not motivate them to want to at least accept vaccinations for the dogs to prevent them from potentially threatening their own families?
Yeah, let's take a minute to answer those questions.
Okay. Thank you, Helen. You talked about engaging the poachers. And actually, we've started to engage them. We call them reform poachers. We hoped some of them backslid, though, during COVID and went back into the forest because their sons were not bringing money home as porters. But we at the time that our organization was allowed to go and continue working during COVID when everyone else had to stay at home because we were considered essential workers because of the One Health, preventing disease between people and gorillas. But then when a gorilla was killed by a hungry bushmeat poacher, who was spearing a bush pig, and the head of Nkuringo Gorilla Group, Rafiki, unfortunately was killed, which caused a lot of problems. The chief warden said, "Oh my God, this is an urgent activity. We need to engage reform poachers." So we did start to engage the reform poachers, getting them to tell people not to enter the forest, even if they're no tourists. Tourism will come back eventually, but we have to protect the gorillas. And so I think that's a very good idea. Engaging the reform poachers helps. A lot of what they needed also is alternatives. So we are offering them livestock so that they don't have, if they're looking for animal protein, they can have their own farms, like goats or cows, instead of going into the forest to poach. And we're doing it as a group activity as well.
Yeah.
So that's one thing that we're doing, engaging the reform poachers.
Yeah, I guess before we go to you, this is, I think the most important thing is always to have dialogues and sit with those people, understand the base reasons why they're doing what they're doing, like poaching, hunting, and find the solutions together. We've been doing the same, like in Rwanda. We have really the reformed poachers or hunters. I like to call them hunters because they use their dogs to hunt. And they are really becoming successful farmers and protectors of the same places. So I'll give you a chance.
Thank you for the question. Yeah, you would think that because rabies kills people, that naturally people will be interested in for example, controlling that their animals are not don't catch the disease. And yes, I think these remote populations, there is no service as such, a veterinary service as such. I think probably is not incorporated into their lives. And the second thing that I think makes it complicated is the relationship that communities have with their dogs. So in the area where we work, I mentioned they are Muslims, and so dogs are not touched. They have a function, and they are a very important function as guardian animals, but also they clean around the villages. Nobody goes collecting rubbish anywhere, or so they're important for that. So it's a kind of different relationship, and I think that's why it took time for maybe the idea of vaccinating the dogs and handling the dogs, and it's also still complicated because the dogs also are not used to be touched. It took a bit of time, but you would think, yes, of course, why not to do it? And I think, I think it's happening, but also there is maybe a bit of not good information about the diseases. And when we wanted to measure how many people were bitten by rabid dogs or things like that, there was a stigma around it, so people don't want to report it. So we like to measure, we like to see, okay, what is the impact on human survival or disease, and it was difficult. So there is something around rabies as well that is a bit cultural. People take their local medicine in some plants that they use. That's the way they deal with it. But it is a serious case. It's very sad that so many people have, actually die from a disease like that. But it's such a difficult. We know from COVID now how difficult it is to control a virus. So because the domestic dogs are so many, and they are increasing, like as human populations increase, it becomes very difficult. In many European countries, it has been eradicated rabies with very strict, intensive vaccination. But it's a huge task in other countries. So,
yeah, we take one more question here, and
hello. I know that there have been some issues in the past about vaccinating wolves. Can you still do that?
Yes, it's a long story short. Yeah, the wolves are very rare. There are only 500. The government sometimes, doesn't want, that the animals are handled for no reason. But eventually, whenever there is an outbreak, they approve for handling and vaccination. But then we started delivering an oral vaccine, and they really require a very strict trial, fair enough, which we've been through that, so that you try the bait before and after, animals are doing fine. So finally we were allowed to vaccinate. But so there are moments on the process that the government is reluctant to progress. And now there is the vaccine we were using, the oral vaccine. So we deliver with meat inside and the wolf eat it. the production stops, so we have to start with a new vaccine. And the government saying, "Oh well, I mean, do we have to go through that whole process again? We'll see, we'll try." But it's something something we need to start doing right now, because we have to keep giving the oral vaccination. I think it's the safest way to save the wolves. So we need more research. So it's another of our needs that I forgot to mention. Thank you.
We are running out of time. 30 seconds. I have the microphone. I give you the floor.
Yeah. To vaccinate gorillas.
Yes.
Yeah.
Gladys,
yes.
you have 30 seconds.
30 seconds to
Yeah.
answer that. You can vaccinate gorillas, and it has been done in the zoos. The gorillas have had COVID vaccinations because the gorillas at San Diego Zoo, nearby here, got COVID, and the elderly silverback was going to die if he didn't get monoclonal antibodies. And then also the gorillas at Zoo Atlanta got COVID, and also in Prague Zoo in Czechoslovakia. So yes, they can
Did they
be
die?
vaccinated.
They infected.
Thankfully, none of them died because they got the treatment soon
Yeah.
enough. But vaccinating wild gorillas is another issue. It's not out of the way, but would rather first vaccinate the people around them so that they don't make. And that's another thing that we did during COVID.
Yeah.
We really pushed for vaccination, and we pushed for rangers and everybody, great people working with great apes, to be the first to be vaccinated, along with health workers. So we successfully advocated to government for that,
Yeah.
which I'm really pleased about. Yes.
And again, yeah, this is where even the science we do with people, like during the time of COVID, when we advance, we also get knowledge how we can help species like those gorillas in the zoos that were quickly helped because of what we've been able to achieve with humans. So it all comes together. So unfortunately, the time is not on our side. We are going to.
Can I say one thing?
I will encourage. I think I'm going to encourage all of you really after this to come and talk to us, talk to these amazing women. And really, I would like to also request a round of applause to these women and their amazing work they're doing all the time.
Can I just say one thing before I forget? You talked about the reform poachers. Some of them, we're engaging them in growing coffee. And the coffee is being sold upstairs.
Oh.
Gorilla conservation coffee. You can support
Very
conservation
important.
like that. And I've written a book about my conservation journey. Dr. Jane Goodall wrote the foreword and how it's been shaped by One Health. So it's coming out in December.
Look for it.
And you can pre-order it, and there's information about it there as well. But we'll get WCN to send it out.
All right,
Thank
yeah. I will welcome Sophie. Sophie has one very important communication.
Yes, lunch.
Yeah.
Just a few logistics to share with everybody. There are actually 4 floors to this whole building. Lunch is being served on this floor as well as the second floor. Please, I thank you all for your patience as you go through the buffet lines. To note, there is seating available on all 4 floors of the building. So including the 3rd floor, which I know there isn't an auditorium up there, but there's some beautiful seating with some gorgeous views of everything going out on the bay. On the 4th floor, it is all outdoors, and there's also table available for seating as well. And then also drinks. There are drinks on all 4 floors. So if it's too much to carry your plate of food as well as your drinks, feel free to grab your food down here, head to another floor, and then grab your drink.
Thank you so much.
Thank you.